Auzu billahi minash shaitani rajim. Bismillahir Rahmanir Rahim. 6 years ago, I spoke about stress management. That was my first, I think the last health talk, and was very much nervous. At the time, the total attendance was, I think, about 500. This time, I think we'll exceed 1313. I hope 6 years down the road, there are more than 3 times or maybe 5 times attendance of Ansar, and I'm also a participant. A few weeks ago, President Sahib visited our Jamaat, and in the end, he took me away and asked me how we can help our families. Then we both decided that we love our family, but there's a problem in our families, how we can help. He came up with this idea that we should talk about something, emotional issues. It is a very sensitive issue to talk, because when you talk about these emotional issues, everybody thinks there's a crazy guy, filthy, dirty, hearing voices, throwing stones, or dysfunctional at every level. That is, about more than 2 decades ago, when I was doing residency, and we went to see a patient as a consultation, we saw a second-year neurology resident coming out, and we say what he wrote. He made the recommendation, long-term placement in lock-up facilities. We laughed. Here's a doctor, white Jewish guy, what he's writing. In fact, that was not the case. Move forward 25 years now, still, I assure you, there are many doctors who are sitting. Time and again, when I see them and I interact them in the hospital, they have no clue how to diagnose and treat the patient. That is how about masses. Now we also came that everything, most of the, we see that severe patients in our mind, but the psychiatrists or the emotional issues are this much. One big part is that when interaction problem between husband, wife, parents, children, families, or so on and so. Because I'm better than you better listen to me. I'm your supervisor, I'm your husband, I belong to bigger nation, you believe to me. That is ego, which is a reflection of Iblis who said this thing, and they are the follower. But basically, today's topic is we have chosen those illnesses which have identifiable physical causes. So I will go from there. We'll see that how it works. We'll give you some scenario, and most of the scenario I have selected which are really true, and I've seen those patients. The first slide is keep the lights on. Someone is standing. Middle-aged, divorced African-American immigrant, high school graduate. After moving here, she married, which ended in divorce because of husband's cheating and drinking. She has no children. She has no marketable skill. She worked at the Walmart, where a lot of standing, walking, and lifting is required. She lives independently, and she takes pride in her job. She has 2 sisters who live nearby. She has to stop working due to back, knee problem, increased weight, and advancing age. Father, an immigrant, blue-collar worker. At times he drives cab. For the past several weeks, son is acting strange, isolating, is irritated, angry, as if he is in own world. he is changed. Two episodes happened. One was a big one. He was found standing in the middle of the road, shouting, warning people to hide, as Satan is coming, police has to arrest him, bring home. Father believed some kind of magic or jadoo is taking place. Again, through mutual friend, the patient and the father were both seen, both interviewed together and separately, but mostly father talked and son listened. The doctor in the end asked, is there any use of drug? Father and son vehemently denied. No, it is not possible. We are Muslim. My son is very good. It is not possible. Again, the doctor say, please check his room. They went home. No call for 3 weeks. After 3 weeks, father called and told this thing there is some strange kind of prescription in his room. When son was confronted, he accepted and agreed that I have received this prescription from my primary care physician. That the prescription was Adderall, which is a stimulant. Son says, I was struggling to grasp what is being taught. It's too difficult. I took it to increase my attention and concentration, so I get good grades to fulfill the dreams my father had. The conclusion is, our family, before that I tell you this thing. Young boy, second year in college, I personally know. Very good boy. Nothing else he is doing into weights and power training. Getting good grades. One day he came to his father and showed some kind of bottle. Father is doctor. Read it. He knew this thing, what's going on. He tried to explain, but he stopped. Next day, he called his friend, doctor. Both very politely explained to him the thing he bought online is not good. These are the side effects. By the way, that when the boy came, he said that when I take this thing, as has been advertised, I can lift more weight and I do more energy work, as well as I've noticed this thing, my attention and concentration is also improved. Both the doctor explained to him when we came that can cause renal failure. The young boy really was startled. He threw this bottle. There, one more young boy, a woman works with me, came tearfully to me. Doc, I really have a problem. My son, I thought he's very much into muscle building. Now we found out that he has gynecomastia, that is enlargement of the breast. When he was confronted, he said that he's taking anabolic steroid. Another young man who has testicular cancer. What is the conclusion here? Our families are not immune to drug use. Trust me. Keep friendly and open communication with children. Avoid excessive performance pressure. Pick up early clues if something is wrong. Involve in your children's life when they are getting B or C grade in the elementary school or middle school or high school. Do not ask them at the time when it's already very late. Third thing is this. The next slide, please. What is common among these people? Very famous. Just read this thing. Muhammad Ali, Abraham Lincoln, Sigmund Freud, Vincent van Gogh, Winston Churchill. Just think that. What is common in them? Think that. One thing we know, this thing, they are very famous and successful. Anything else which is common? Any guess? Muhammad Ali has fear of flying. He refused to go to Rome Olympics till the end. His coach begged him. He was finding out, is there any way he doesn't have to fly? He didn't find anything. But he wanted to go. He bought a parachute, put it strapped on his back, sitting in the seat. And just fear of flying, he was just praying for a safe arrival to Rome. That is known as aerophobia. Second is Abraham Lincoln. See his face. He may have some medical illness, but if you see his face, very gloomy, depressed, but very successful. Why a person who lost his mother at a very young age, lost his sister, older beloved sister at age 18, lost his 10 or 12 children, who will not be depressed or anxious, but see that his own medical illness and these kind of emotional illness did not hinder him to achieve what he achieved. Next is Sigmund Freud, world-known neurologist and the father of psychoanalysis. He suffered from agoraphobia. I will describe what is that. Vincent van Gogh, we all know, born in 1853 and died in 1890, or possibly he committed suicide. Very famous artist. He had thought disorder or bipolar disorder, epilepsy, severe anxiety. Last one, but not the least one, Winston Churchill. Everybody knows him. He suffered from manic depressive illness, that is bipolar disorder. He used to call his depression as a black dog. Did it hinder his performance? No. Everybody has anxiety. I have anxiety speaking to so many people. When you see any authority figure, particularly Pakistani father, when you go in front of him, you have anxiety. This is true. Or immigration officer. Anxiety, which is little bit anxiety, is good and healthy, which helps you to prepare for the performance. When anxiety interferes with daily life adversely, then it falls into anxiety disorder. The cause, basic cause is there, very simple, brain and environment. In brain, we say dysfunctioning of the brain circuits that regulate fear and emotions. Long-lasting stress can cause changing in nerve cells, circuits. Certain type of anxiety disorder have changes in brain structures that control memories linked to emotions. It may be more common in families, or it may be due to environmental trauma, particularly childhood. What is agoraphobia? The literal meaning of agoraphobia is fear of marketplace. But psychiatrically, environment or situation where a person believes it is hard to escape, like crowds, bridges, public transit, being outside or even alone, that is agoraphobia. Then there is claustrophobia, enclosed space. Aerophobia, Muhammad Ali. acrophobia, fear of height, generalized anxiety disorder, which interfere with our life. Obsessive compulsive disorder, you just think about one thing and then think about it, and you do like this thing, you walk here, do some kind of ritual to undo that, but that thought do not go. PTSD disorder, I am the head of the PTSD department. I see firsthand young people and old coming from the war and how they present very severe, disturbing condition, disabling condition. Another is panic disorder. It's very important, I want to touch it, how it presents. There's intense anxiety and fear without reasonable cause. Patient or person shows or symptoms are shortness of breath, hyperventilation, palpitation, chest pain, choking feeling, nausea, sweating, dizziness, fear of dying. These people are taken time and again by ambulance to emergency room. Millions of dollars work is done. They show up next day or next week to another emergency room. Same thing has been done and turned out to be this is panic attack. I can briefly say that basically therapy is most important. In acute states, we give them in this anxiety disorders are either anti-anxiety or antidepressant. By the way, I touched to bipolar disorder. It is consistent inside feeling which you have about yourself and your life. That is the mood. And we all have down mood and up mood. But when it goes beyond certain level, go down, like black dog, then we call it, they have depression. Or they can swing up opposite, very high energy, no need to sleep, trying to do multiple tasks at one time, but not accomplish anything, involving in very risky behavior. That is mania. That Churchill has, basically anxiety disorder. Dr. Saib sitting here, he has very high functioning people. You cannot believe they have different kind of emotional illness. They come to him once a month, once in 2 months to 3 months, very short therapy and take medication, go. That's why we are again emphasizing, you have to connect with some real source. Everything is not untreatable. Next slide, please. We gave this title, Not a Bad Mother. We are men, maybe we don't understand, but this thing happened under our own watch, left and right. I gave example with that a mother of 4 weeks old infant is found tearful, depressed, withdrawn, suspicious, not interested in her child. At times she hears voices and even have thoughts of hurting herself or throwing him out of the window. Husband and father are very worried. By the way, father is also in a top-notch medical profession. When he contacted a doctor, he was really panicking and tearful. He doesn't know what to do, what happened to her daughter. The again thing is this, after childbirth, be supportive. Look for strange behavior. Set up help. But by the way, this patient has been treated successfully. Thank God it did not evolve into something serious, but with close observation, some medication, regular follow-up, the end is good. The last slide, I thought a few times, should I present this last slide or not? Again, I was debating myself, should I present this slide or not? Because this This is affecting almost every family, if not today, tomorrow. What is common among these following scenarios? He tried to choke me. I was on call. 80-year-old, brought by police, handcuffed, accompanied by wife. She's afraid, guilty, and fearful of her life. Reportedly, he has been acting bizarre. He's agitated, depressive, not sleeping, verbally and physically abusive, has severe memory loss, and he cannot be left alone. In the middle of the night, this man wakes up and tries to choke his wife to death. Number two, she does not care. I have seen this. Husband finds her 75-year-old wife becoming increasingly depressed, anxious, mostly in bed, gaining weight, losing interest in TV or day-to-day activity, misplacing things, not sleeping. She does not care about anything anymore. On surface, the diagnosis look very different. On the surface, if you see that with this diagnosis, it will be difficult till you go further. What is the answer? The next slide. The answer is they are suffering from dementia. As we are having aging population, this serious problem. Dementia is a general term for loss of memory and other intellectual capabilities severe enough to interfere with daily life caused by physical changes in the brain. By the way, the first instance was the behavioral complication of dementia. The second case was depression due to dementia. The most common of these group of diseases are Alzheimer's disease, vascular dementia, Parkinson's disease, normal pressure hydrocephalus, Huntington's chorea, Wernicke-Korsakoff syndrome due to lack of thiamine due to alcoholism. We see, basically in Alzheimer's disease, we see plaques and tangles in the nerve cell or between the nerve cell. The main problem is memory, thinking, judgment, social skills. In the beginning, the problem is with attention, concentration, retrieval of the past events. Difficulty remembering recent conversation, events or name. Loss of function like doing daily chores, balancing checkbook, appointments, eating, apathy, depression. In later stage, in the beginning, there is a long, short-term memory loss, but very clear about the long-term memory. Later part, all the memory is gone, both short-term and long-term. Lack of communication, judgment, disorientation, confusion, behavioral changes, difficulty in the head, difficulty speaking, swallowing, walking. The need treatment is basically supportive, supervision, safe environment, social connection, mental activities, so they can stimulate. There are many medications we can prescribe, but there is no treatment. Why I talk about this issue? We have seen this thing. Trust me, I have seen this thing, left and right, that this is getting worse and worse. Many people in our culture, no matter what, father or elderly should be home, whatever the consequences are. We cannot abandon them. Responsibility, culture, or guilt, I don't know. On the other hand, Western culture has abandoned this thing and asked the society to take care of that. I go, this is one place, and other is this much. When I walk in the morning from parking lot towards my ward, the nursing home is there. I see a woman sitting in a wheelchair. One time, two times, multiple times, one day I stop. I ask, what is the problem? Mama is waiting for her son's call. 5 Christmas have gone. Last time she heard, he did not visit. 5 years ago he called. That is abandonment. So we have here, Islam teaches us. Time?
No,
Huh?
no, we have time.
Islam teaches a middle road, practicality. It also balances both the things, responsibilities and entitlement. So I'm throwing this thing to the people here to look into that. If not, things have really adverse effect on the caregiving. They suffer more than the patient. There are people in this audience, personally I know, we have to really address this issue. To connect all the services which are needed, we should find those things, comfort the patient, but we have to comfort the caregiver also. Here I will stop my speech or talk. I think we'll entertain questions.
Sayyid Burhan Qadri, Jazakallah for a very insightful talk. I'm concerned, one of my close relatives passed away with dementia. So what are the factors a person should do to decrease the onset of this deadly disease?
Do you want to answer? Want to answer to that?
No, I think that. Okay, sit here. I think that's what I was thinking, that should I bring up this issue or not. This is not about dementia and prevention. This is basically how to care for the patient and how this caregiver can deal with this ultimate, very serious condition, seeing loved one deteriorating to the point they become infant. That was the reason. I brought it from that. But as far as dementia, I think there is no clear-cut treatment how we can defer or prevent dementia.
Assalamu alaikum. As Dr. Saf said, that's a very chronic illness that starts generally around age 65 and goes on. There are a few ways to find the early onset of early symptoms of dementia. As we know, dementia starts from now and backwards. That means the person starts forgetting things what happened just 5 minutes ago. And then it moves back, and eventually the things, those are younger age that we start forgetting. So the bottom line is, as soon as someone starts feeling that the other one has started forgetting things that we just talked, there are a few things that can be done. There are some cross puzzles, using brain more, trying to memorize things. The bottom line is, whatever you use, you keep it. Whatever you don't use, you lose it. So make the older person to have brain exercise as much as possible. And at the same time, definitely contact your physician and see what the physicians can do at that time. Early intervention with medication will prolong the onset of dementia. One thing, when dementia starts, it goes on, it never stops. But what happens with medication and with the brain exercises, let's see if one-digit memory is going to be lost in 1 month. If you can delay that one in 1 year, you are gaining maybe 1 to 10 years. Those will be much better, that the person will have much better quality of life. So early intervention is always very, very important. And many times there can be very simple things that we can find out with the lab results, and replacing some vitamins that can remove that dementia very completely, quite for some time. Thank you.
Assalamu alaikum. Jameel Chaudhry from Central Jersey. Dementia patients, when they reaches a stage where they need a 24-hour care, is there any, besides government, which they provide facilities for the senior people, and there are residence houses where they can be put in that and they are taken care of? Is there any such facility Jamaat is thinking about for Jamaat Ahmadiyya, such people who have no support at all?
I think that's an administrative question. As for the facility goes, it's very expensive, if I say, because there are lots of things needed there, and I don't know. I think I better off don't answer this question if it's on the Jamaat level.
I'm not talking about this thing that Jamaat, but even society is facing with this problem, because it takes $50,000, $60,000 or $70,000 per year from adult home and nursing home and so on, plus treatments. Really, it is a very big chore. And even if you try to hire some help at home, if it is a caregiver, $10 an hour, usually they are not that much trained. Sometimes they may come, sometimes not. If you want a skill, nursing available, they will charge you about $50, $60, or $70 per hour. And how many people can afford that? That's why I brought this thing, a very challenging thing. And then keeping the people at home, I'm not saying keep it or not keep it, but we are just here to interactive discussion how to solve this problem.
Assalamu alaikum. Arshad Rashidi from LA Riverside. What do you suggest as far as overcoming the confidentiality that exists between patient and doctor and other family members? How can they overcome that? Because often you're relying on the family member telling you what the doctor said or didn't say. And how does a family member get involved in that process?
Repeat your question, please. Can you repeat your question?
I got it.
You got it?
You got it? But
It's very different in other disciplines of medical field as compared to psychiatry. In other disciplines, things can be shared with the family members to some extent. In psychiatry, it's out of question. Any family member can ask anything about the patient to the physician, and even, in fact, we don't acknowledge even this person belongs to my clinic. And if anyone wants to get information, generally our answer is, okay, I don't know this patient, please ask the patient to call me and come in, ask and give me permission to talk to you. And that permission should be in written. And to what extent, it depends on the patient. And it starts after age 18. To some extent, kids from after age 14 can also restrict to some level, but not completely.
So you're saying the patient has to give the permission for that to occur?
I'm sorry?
You're saying the patient has to give the permission?
It should be written permission, exactly.
Thank you.
I want to add, can you please come back? This is general question what you ask. Many people, their loved one has emotional problem. They don't want to go out. Or they don't know, or they don't want to go out. Many Jamaat people have contacted me. I've seen their loved one at my home. Most of the time, my children think that I've invited them for food. They really don't know. And I can tell you this thing. Father of young girl contacted me. I can see his eyes asking for help. But before he asked, Doctor Sahab, किसी को पता तो नहीं लग जाएगा? That is the main problem. Unfortunately, we are very close-knit Jamaat, but we do not respect that kind of thing. If one person has something, next day, most of the people, I have never talked to anybody, I assure you, if he has come, some people, very educated, in Jalsa Salana talking about, hey, this is a guy who helped my daughter. And I asked him to stop it. Sometimes it is too much out of the hand, too much. That this Jalsa Salana young man, he was tearful. Dr. Saab, you have seen my wife many years ago. Can you see my son? Can you see my son? I will bring him any place. That is the height of his humility. That is torture. He's talking, he doesn't care now. So it is a very complex issue. Very complex issue. I think most of my family, my siblings don't know who came to my home. But I have no idea if they themselves go outside and display that thing. Thank you.
Zako.
Mohammed Chowdhury from Virginia, Ansar. My question is bipolar disorder. What can you do with the patient? I read on internet a lot. There is, in the end, it says you can do nothing, just let him suffer. Just leave him alone.
Can I answer? First of all, what is bipolar disorder? Most of the people say, oh, anybody who's crazy, he's acting bipolar disorder. He is like this. I explained you, as told you, we all have mood, feeling of ourself, well-being, happy, sad, gloomy, or some people are just happy, correct? But that is loss of job, car broke down, or just you have anxiety in this. You feel sometimes depressed. But this is our mood. It can fluctuate day to day, month to month. It is a bumpy road, fine. Once you go below down, you feel so sad, unhappy, hopeless. Life is not worth living. Nothing interests you. Day after day, it is not normal blue. And then further, your sleep is disturbed. You don't want to talk. You push yourself to work. Performance is down. And sometimes people tell this thing. What do you mean? People are on their back. Why don't you go out? Why don't you do this? He doesn't. Basically, mood is a gas in the car. Mostly nothing is wrong with the engine. They don't have that soul or that drive or energy. And thought process are something wrong with the engine. That is your thinking process. Very simple thing. But don't think that every bipolar is not treatable. Or every bipolar will end up like Alzheimer's disease end. There are people who can have one episode today, or maybe they not have 5 or 10 years down the road. Some are rapid cycler. Sometimes their intensity may not be that good. If you see doctor early and they have good communication and family support as well as medications, I think many times we can control it faster. We can prevent next episode of depression or mania. Like we all are a human being here. We are not equal in many ways. So don't think that it is as hopeless or that it is not treatable. It may not be treatable, but definitely it can make you functioning. So this is not really, I will say it is hopeless thing.
Bipolar people can be very successful in their lives.
Assalamu alaikum. Thank you very much for bringing awareness to this important topic. As a geriatrician, I wanted to add some advice in terms of prevention of Alzheimer's disease. So my name is Dr. Mahmood Qureshi. I'm from Connecticut. And there's a study out of Minnesota through Mayo Clinic where it showed that 4,000 people who had first-degree relatives with Alzheimer's disease, walking 45 minutes a day prevented or delayed the onset of Alzheimer's disease. So another name for Alzheimer's is diabetes mellitus type 3. So all those factors that will help you control your diabetes will also control and prevent Alzheimer's disease. So that is an important prevention that all of us can do as a general body. If we increase our walking, it can prevent Alzheimer's if we have a first-degree relative with this disease.
I think, Dr. Saab, wait, Dr. Saab. You're right. This is Mediterranean diet, what you talked, cardiovascular, risk factor, diabetes, they can. But those people who develop Alzheimer's disease at a very young age, generation after generation, those are 2 or 3%, but they have some genetic problem.
Right. So, so just to elaborate on that, there are two types. There's early onset and there's late onset. And the reason why I can comment on it because I'm actually part of the Medical Scientific Advisory Committee of State of Connecticut for Alzheimer's disease. So there is the genes called ApoE4, which are the ApoE genes, which are predispositioned to having late onset Alzheimer's. And then there is presenilin genes, which are the early onset Alzheimer's. Early onset, when I'm talking about the prevention with walking, is the late onset diabetes, and that was, Alzheimer's, that was studied at the Mayo Clinic. Yes. So walking for this body is actually a good thing, and it can prevent Alzheimer's.
Jazakallah, Dr. Saab.
All right, sir.
Assalamu alaikum, Tala. Halim Chaudhary from Baltimore Jamaat. Quick question, as Dr. Saab mentioned that brain games could help maybe retain or slow down the loss of memory. As we age, we all lose some memory, and we are all probably susceptible to these kind of diseases which I mentioned. My understanding is I read somewhere, and I want you to comment on this, that does challenging your mind, like by way of learning a new language, does it really helps? And if it does, probably, our Talim department has to do something on this, that they may help us all to learn the language of the Holy Quran, starting now, so that, we can reap two benefits with this, like challenging our mind, learning new language, as well as trying to, lead a more healthy life and retain our memories too. I just want your comments, like your expert opinion on this. Jazakumullah.
Go ahead. Definitely it's whatever is your primary interest, that you can go with that one. The purpose is that how much you will push your brain, that much you will be able to keep your brain for a longer time. And definitely which part of the brain will be working when you are doing certain things. If you are doing broad things, it will stimulate most of the parts of the brain, and definitely will help you on much extensive level. But whatever is person's interest, you cannot push that age person, okay, you could just do this thing. That cannot happen. The purpose is that keep the person comfortable and still be helpful. So it depends on every person.
And Kai Talim Saab is right back there. Meet him afterwards. Next question, please.
Assalamu alaikum. My name is Rahman. I'm from the RTP Jamaat. I have a general question about religion and mental illness. My question is, psychosis is a mental illness. Islam and religion is a belief system based on thought and the mental state. So my question is, how does our faith in Islam and prayers affect and improve issues of mental illness? Can faith totally remove mental illness, and are there any studies on this?
It's just not in Islam. We see people in this country starting from I see people from very young age till 100 years old. And very surprisingly, when we see people over age 70, and their answer is, I go to church. So it's not just in Islam. It's pretty much in every religion. When we come to age around 40, 45, they are receptive to some level of treatment. When it comes to the age, 20, 25, they're perfectly okay. They say, all right, I need help. The thing is, when it comes to religion, I think we have to keep it totally separate, because there are very definite mechanisms behind what is going on in brain when someone becomes psychotic. It's very simple, or it may be very, very complicated. If I can say very simply, what happens when I'm seeing you, there's some rays coming to my eyes, going to my brain, and getting translated somewhere in my brain, and I see you. And if you are not present, and if that same particular stimulus happens, I will still see you. So that is psychosis. Or if I am hearing somebody or some noise, and very surprising, it was stimulate the same part of the brain, and I will hear the same voice, even though it's not there. So religion has nothing to do with that one. Religion cannot remove any kind of illness. Yes, sure, it will ease your perception to your illness, and your confidence, how you can help if you really want to take that way, to how you can get help and how you can get better. But one thing, brain is part of the body. If heart can get sick, brain can get sick too. If brain gets sick, it has own illnesses, depending on whatever happened. So religion will be helpful, but it's not going to be a treatment.
Okay, so we have 2 more questions. We just have 2 more minutes.
Oh, 2 more minutes. Okay.
Next, please.
Assalamu alaikum. I'm Abdul Jabbar Rafiq Api from Chicago East. I have one quick question. Can lecithin help restore cognitive memory? Lecithin.
What is that?
Relationships. Yeah, definitely. In fact, what happens in the joint families where there are kids, children, grandparents, parents, those grandparents have much lesser dementia. And sure, if someone is prone to dementia, will develop dementia, and it will be much delayed as compared to the families where the person is totally isolated and there's nobody at home, there's no stimulation from children or grandchildren.
Social connectedness is very important. Very important. In mood, even in those kind of cognitive deficits, even in thought disorder. Social connectedness is very, very important in human being.
Jazakumullah.
Last question.
Mirza Shah Ali from Houston South. I saw a program on TV that
Shasa, we can't hear you.
walking, we are all interested in some exercise at this age, but they told that walking on a treadmill in 20 minutes in your room is not the same thing walking on the road in open air. I have seen the difference. They told that if you walk in open air, there's release of some additional hormones in your body. If I remember it correctly, it is most probably serotonin. And I certainly felt like expressing it, and also wanted to support or agree with Dr. Mahmood that walking in the open air is much better than walking on a treadmill for the same time in your room. Thank you very much.
I think it makes sense when you go out, you see outside world, not the walls. And those other sensory stimulants are also working in your favor. That is very nice. Fresh air, see the scenery, other people, or nature as a positive impact.
And one thing, something is better than nothing. So if it can be in the home, that's okay. If it can be out of the house, that's definitely going to be better.
This concludes. Jazakumullah. Thank you for your attention. I just want to make a quick announcement before I pass over to Monas Chaudhry Sahib. We still have the screening clinic in the basement. We'll check your blood pressure, sugar, BMI, etc. We also have a limited supply of some medications. We will be here until Isha and until close tomorrow. We might step out just for the prayers, but other than that, we should be there in the basement. Jazakumullah Sahiban. Thank you.
रोशनी का सफर